Do you own an annuity, either fixed rate, indexed, or variable? Are you paying high fees and getting low returns? If so, Annuity General would like you to have this free book to learn the pitfalls and mistakes of buying an annuity. The Annuity Do's and Don'ts for Baby Boomers contains the little-known truths about annuities, like how to help reduce your fees and increase retirement income. And it's free. That's right, free. As a bonus, we'll also throw in a free annuity rate report just for calling. We researched over 1,000 annuities and summarized rates and benefits from financially strong insurers. You get Annuity Do's and Don'ts for Baby Boomers and the Annuity Rate Report, both absolutely free for calling Annuity General today. Hurry, supplies are limited. Call now.
800-760-1845. 800-760-1845. 800-760-1845. That's 800-760-1845.
All right, everybody, it's a gorgeous day up here in New England. This is Marcia Hawkins, and welcome to Elevating with Marcia. Welcome to the show today. Elevating with Marcia is a great way for you to elevate your business. Why don't you come on Elevating with Marcia? Direct message me via Facebook or Instagram and learn how you can feature your business, your products, your services with a red hot podcast. We can create some super fans for your business. We'll take the hour, deliver your message, your personal message about your business in a podcast format. Your audience can find the show broadcasted on XM 203, Sirius 217, and on the Sirius XM app, 967 Sports Byline USA Radio Network. Also broadcasted on iHeartRadio, Amazon Audible, Stitcher, iTunes, Tuned In, and the American Forces Radio Network. Today's show is brought to you by myhealth-quotes.com. I can teach you how to navigate crucial information to ensure you're able to make a knowledge-based decision when it comes to selecting the right health plan for you and your family. It's simply not advised to go online, get a quote, purchase a plan without really understanding the underwriting guidelines. Very critical information that you need to ensure you select a plan you're actually qualified for. Very important information. And open enrollment is still ongoing in some states up until August 15th. So we're running out of time here. And in some states, they've already shut it down, and you will have to wait for open enrollment, which starts in most states on November 1st. So we're going to round the corner for open enrollment 2022 soon. There's a lot to navigate. You can also stop by my website, elevatedmediaesq.com. We do it all from video marketing, social media management, and more. Stop by our Facebook or Instagram page at Elevating with Marcia. We post information, sports news, business and lifestyle tips, and ideas to help you elevate yourself and your business. Today's podcast on Elevating with Marcia, we're going to be talking, and I'm going to dedicate it to health insurance. The open enrollment period is ending soon, and I want to be sure you have all the details to enroll and not miss that crucial information. This is Marcia Hawkins on Elevating with Marcia, XM 203, Sirius 217, and on the app at 967 Sports Byline USA Radio Network. We're going to take a quick break. We're going to be right back with Elevating with Marcia.
The world is changing so fast these days. You ever feel like you're not keeping up personally or professionally? Enter Elevated Media ESQ. Elevating with Marcia allows you to advertise in a forum you never thought possible. They feature a business in an interview-type fashion, which is comfortable, amazingly affordable, and flexible. Not only that, the feature on your business is then formulated into a podcast for convenient, on-demand listening 24/7, 365. These times we're living in demand a different, clearer, more concise message. Does this sound like how you feel about how you market and advertise your business? Reach out today, no matter how big or small your business is. Elevating with Marcia is highly effective, and you'll be so grateful for the superfans she'll create. Email hello@elevatedmediaesq.com. Elevated Media ESQ, changing your business for the better.
Angie's List is now Angie. Summer is the perfect time to book your next home project. From lawn care to a new patio, Angie makes it simple to connect with pros who can get the job done right. See reviews, upfront pricing, and instantly book hundreds of projects. Plus, when you book and pay through Angie, we'll cover your project up to the full purchase price, plus limited damage protection with our Happiness Guarantee. Check out Angie.com, and for more on the Happiness Guarantee, go to Angie.com/happiness-guarantee.htm.
Can you name the 3 habits of healthy hygiene? We shower, we brush our teeth, and we... Wait a minute. What third habit? Think about it. The pandemics reminded us that the nose is your body's filter against a constant invasion of airborne germs. Your nose traps allergens, bacteria, and viruses, but like any filter, the more it's clogged up, the less it works. Now it's easy to clean your nose with Navage. My name's Martin Hoke, and I did not invent nasal irrigation. It's been around thousands of years, but I did invent Navage to make nasal irrigation easy for everyone. Navage uses powered suction to flush out germs that cause congestion, or worse, can make you very sick. People love Navage. It has 4.7 stars with over 70,000 online reviews. And over 2 million people use Navage to breathe better, sleep deeper, snore less, and feel healthier. Go to Navage.com or find Navage at Walgreens, CVS, Rite Aid, Target, Bed Bath, and select Walmarts. Make cleaning your nose your third habit. Navage. Clean nose, healthy life.
Between jobs, retiring, or just need health or life insurance, please visit myhealth-quotes.com or call 833-687-5261. Before you try to get a quote online, call us. We will provide you with the information most sites will not. We teach you exactly what life or health insurance plan you qualify for, how to use your plan, and maximize your benefits. We provide you with the information to make a knowledge-based decision to ensure selecting the right plan. myhealth-quotes.com to schedule an appointment.
All right, everyone, welcome back. This is Marcia Hawkins on Elevating with Marcia, Sirius XM 203, Sirius 217, and on the XM app where I listen at 967 Sports Byline, USA Radio Network. Today, we're going to talk a little sports, and then we're going to delve into a subject that I think is important for everybody, right up there with purchasing a car, purchasing a home. We're going to talk about health insurance today. All right, so we have the preseason with the NFL underway. Very exciting time. I kind of get into the preseason a little bit. I do watch it because it's football, and after the Super Bowl, I kind of go into a little bit of a funk, a little withdrawal, if you will. When football is no longer, on, I get the Pro Bowl, but now they even have that the week before the Super Bowl. So once the Super Bowl ends, I am simply out of luck. The good news, I do tape the game and sometimes rewatch them, especially if it was a barn burner or a real exciting game. But when there's nothing else to do, just to get a little bit of my football fix, if you will. And then, of course, a few weeks later, we roll right into spring training. But we are weeks away from the opening season of the 2021 football season. I'm still searching for information on where the NFL stands with their COVID vaccine mandate. Now that it has been mandated, Cam Newton, I guess, was asked the other day at a press conference whether or not he's been vaccinated. However, he declined to answer. A lot of people know he had COVID last year. He was sidelined for 14 days. He did test positive. So it kind of begs the question, does he have the antibodies? I'm kind of wondering if the NFL is rethinking their strategy on whether or not if you've had it and possibly take a test to prove you've got your own immunity with the antibodies already in your system, or whether or not they're going to require you to get the vaccine no matter what. Again, last week, we talked, a couple of coaches have opted out for the 2021 season and retired, not wanting to get the jab. Again, I never want to be controversial on the show. I believe that vaccines are a personal choice, and I'm not here to tell anybody what's good for them or what's not. But sometimes offering up helpful tips can be beneficial, but vaccines are clearly out of my realm. I'm still of the belief, and I'd be hard-pressed to believe that Tom Brady would take that vaccine, knowing how orthodox. He is very orthodox about his fitness regime, his workouts. He's on a very strict diet, even in the off season. I remember one time he was asked whether or not he was going to grab a beer after they won the Super Bowl when he was with the Patriots, and he said, "I can't. Next week I'm in training." I mean, I don't even think he took a couple of days off. He rolls right in. So he's pretty orthodox. So I'm curious as to whether or not he's going to take the jab. So it'll be interesting to see. I am following that. Thus far, I have not run into any news whether he has declined it. Obviously, if he does, there's going to be ramifications for that, or whether or not he's already been vaccinated, or found out last week he played hurt last year. Maybe he's already had COVID, or maybe he's already been vaccinated. So I'm going to monitor that. If I come up with any information on that, I will certainly divulge that on the podcast. And I don't remember last year. I don't remember any of the active players. I know there was a few retired players that did come down with COVID and were hospitalized, but I do not remember anybody on an active roster, whether or not they came down with COVID. Most of them, if they tested positive, they went into COVID protocol. They were out for 14 days. They were, had to quarantine, and then they came back. And as far as I know, and I will have to check my facts on that, but I do not believe that there was any, active football player on the NFL roster, or coaches for that matter, that ended up, deathly ill from COVID and came back, or God forbid, passed away. But I will check on that. And of course, the Green Bay Packers and their quarterback, Aaron Rodgers, he is back for the 2021 season. They have agreed, verbal agreement for a trade after the 2021 season, if desired. That's the operative word, if desired. Much like Tom Brady, you would think that he would have retired a Packer, but honestly, who knows nowadays? And the Green Bay Packers, obviously, they're obviously happy to have him back, but there does seem like there's, much like with the Bill Belichick, Robert Kraft, Tom Brady saga, there seems to be a little undercurrent there. What that is, I'm not quite sure, other than what he divulged in his news conference, but we are monitoring that as well. The Olympics, lagging in viewership, actually at historic lows. Kind of unfortunate, given that we really could use some excitement after a very challenging sports year last year. Major League Baseball underway, of course, just about halfway through the season. The Red Sox, while they've had some really good stretches, they have had a few stumbles along the way, but I'm sure Alex Cora will get them back on track. Anxious for college football as well to start. And of course, all professional sports, always fun to watch, follow, and take in the action. All right, for now, we're going to divert from sports and we're going to talk about some health insurance news. So as I mentioned in the opening of the broadcast, and I have mentioned it on previous podcasts, we are rounding the corner from the, I don't want to call it a special enrollment period, because that does have a little bit of a connotation to it that might resonate with some people. But we have been in a classic open enrollment period basically since, I want to say, January 1st, which technically would be the end of open enrollment for most states. However, several states such as Colorado, California, Massachusetts, and a handful of others actually almost go into February before their open enrollment ends. Now, why this is very significant is the federal government, as you know, Obamacare, most of you know it by that, they have extended it through August 15th in most states. Now, my state, Massachusetts, they ended it back in July. However, with COVID, with so many people out of work and losing their jobs, they really needed to provide an avenue for people to be able to obtain health insurance, given the fact that COVID has obviously affected all of us in some form or another. Being without health insurance and coming down with COVID could be an utter disaster for some people. I don't know too many people that have had COVID, but I do know there was a local man that had contracted it, owned a restaurant. He ended up in the hospital, I want to say, a good 80 days. And then he was also had to go to a rehab facility for something like another 100 days. So it clearly, if you do get sick, having a good health insurance plan is definitely worth it. There is a lot of misinformation, though, about the ACA plans and then what we call private insurance. I'm going to specifically talk about ACA plans today, but I am going to delve into short-term private insurance as well, because there is a huge difference. A lot of people think that they're one and the same, but they really are not. And I'm going to explain the fundamental difference between them. So if you have lost your insurance in the past 60 days, and what I mean by losing your coverage, it has to be a comprehensive health plan. What a comprehensive health care plan stands for, which is what Obamacare is, or your group insurance that you get through your employer, is what has the 10 essential benefits embedded into that plan. Things like mental health, prescription drug coverage, hospitalization. The big one that everybody looks for is pre-existing conditions are a non-issue. Newborn care, maternity, mental health. I think I already said that. There's a variety of things, but there's 10 essential benefits that are embedded into that plan that you're afforded with the Obamacare plans. Now, in a normal year, if you were to lose your qualifying coverage with your job, you do have 60 days from the date that you lose your coverage. Most people, when you lose a plan, let's say you get laid off on the 20th of the month, that plan will still cover you till the end of the month, but then you would have to apply for the Affordable Care Act, Obamacare, prior to the first of the month in order to get your coverage to start on the first of the month. That's information that a lot of people don't have. They think if they call an agent or they call me, many of you know I do health and life insurance. I'm licensed in over 30 states. I kind of fell into it as a side career, but I absolutely love it. I like the helping piece component of it, and I really enjoy helping people with it. But a lot of people just simply do not understand the details that go into not only selecting a plan, but actually what you're qualified for. So we're going to take, after the break, we are going to get into, what constitutes you qualifying for the Affordable Care Act, because there are details that many of you are simply unaware of. I'll tell you that. And then also whether or not it's, one of those things where maybe you don't need to go the full route with Obamacare, and you'd be better served going with like a short-term plan. If you're healthy and you're able to roll into a short-term plan, if you're just losing coverage for, say, 30 days or 60 days, that might be your way to go. So we are going to take a quick break. This is Elevating with Marcia on XM 203, Sirius 217, and on the Sirius XM app at 967 Sports Byline USA Radio Network. You can find me on iHeartRadio, Amazon Audible, Stitcher, iTunes, Tuned In, and the American Forces Radio. We're going to take a quick break. We'll be right back.
Have you written a book? You can become a published author with Dorrance Publishing, the nation's oldest publishing services company. Countless authors have trusted Dorrance for nearly 100 years to bring their book to the market. Our professional team will edit your text, design your book pages, and create an appealing, eye-catching custom cover. Plus, our authors benefit from a custom book promotion marketing campaign that makes your book available where people buy books, like Amazon and brick-and-mortar bookstores. So make this free call right now to claim your free author's guide to publishing. Don't wait another day. Take one step closer to realizing your dream of becoming a published author and seeing your name in print. You've already written a book, so the next thing to do is make this free call right now to Dorrance Publishing and get your free guide to publishing. Call right now.
800-485-6003. 800-485-6003. That's 800-485-6003.
I'm going to tell you how you can get real health care for as little as $6 a day. Yes, now you can get affordable health care for you and your family immediately and save as much as 50% off your current monthly health care payments. Our plans are perfect for people that are self-employed, can't afford health benefits where they work, or just want to pay less for their current health care. And coverage is guaranteed regardless of your medical condition. We even offer some of the new Christian faith-based health benefits. Save up to 50% on your family's health care. Make a free quick call now. There are no contracts, and we give you a 10-day money-back trial period. Call Provision Enrollment right now for your risk-free, guaranteed health insurance quote starting at $6 a day.
800-472-5145. 800-472-5145. That's 800-472-5145.
If you or a loved one is suffering from a physical or emotional condition that has left you unable to work, then listen carefully. Take this number down. 800-593-7491. That's 800-593-7491. When you call, you'll speak with a Social Security disability expert and get a free evaluation to see if you may qualify for disability insurance benefits from the U.S. government. That's right, a monthly cash payment paid directly to you from the Social Security Administration. Whether you're applying for the first time or you've already been denied disability benefits, call now. The disability attorneys at Pinnacle Disability can help you build your case, file an appeal, and represent you at no upfront cost to you. Don't wait another minute to see if you may qualify for your Social Security disability benefits. Call Pinnacle Disability Group at 800-593-7491 for your free case evaluation. That's 800-593-7491. 800-593-7491. Call now.
All right, everybody, welcome back. This is Marcia Hawkins. It is a gorgeous day up here in New England today. Today we are talking about health insurance. Many of you know, with COVID, the federal government, or maybe you don't know, has extended the open enrollment period through August 15th. Some states like Massachusetts and a few others have shut it down last month. If you have lost coverage through your job, or whether or not you had an Obamacare plan that, maybe your situation changed, one of the things that they did at the beginning of the year, which I really liked, was they actually lowered the income guidelines by almost 10%. I believe it's 9.7%. What that translates into for the average family or couple who has an Obamacare plan is roughly a $70 to $100 cheaper premium every month. That can be, especially if you're collecting unemployment or, you've lost your job and you're not making quite as much money as you were prior to that. That can be pretty substantial. In some cases, believe it or not, the employer plan that you paid for that, if you had lost your job, in some cases, it might be even cheaper now if you're, collecting unemployment or you're simply out of work and you're, living off your savings or whatever that happens to be. In some cases, it may even be cheaper than your employer plan. So that kind of begs the question, if you have group insurance through your job and it would be cheaper to go through Obamacare, why would most people not do that? Well, that's one of the myths that a lot of people don't understand about Obamacare. There's a couple of rules that you do have to follow with the Obamacare plans. One of which is you have to file a tax return. Now, you would think that would be a no-brainer for most people. Well, actually, it's not. I can't tell you how many calls I get from people who have not filed their taxes in several years, or they're just saying, to heck with it. If you are someone who, has not filed taxes in several years or even a year, that would be a huge problem for you in obtaining what we call a premium tax credit. And that translates into you having the ability to have help from the federal government, help paying for your premiums every month. So, for example, if you are in, say, your mid-50s, mid-40s, you're probably, let's say you're a couple, the average in most states for a couple, you're probably looking a little north of $1,000 a month. If you're making roughly $30,000, $40,000 a year, you're probably looking at about an $800, $900 premium tax credit. Again, there's a lot that goes into that formula. I'd have to talk to you personally to find out whether or not that applies, but that would bring your premiums down anywhere from like $1,100 to $1,200 down to like $800 or $900 per with the tax credit. It would bring it down to $200 or $300 a month. That's a lot of money, and a lot of people, when the federal government mandated that some of the employers had to offer, depending on how many employees you had to offer you health insurance. Okay, what a lot of the employers did to be able to afford it, because health insurance has absolutely gone through the roof in the last decade, what they were doing was they were allowing the primary person, that would be the employee, to get a relatively cheap plan. However, when you go to add your dependents, your spouse, your children, they were in some cases almost paying full price. Not every employer did that, but several of them did. And that made it very unaffordable for a lot of families. So I do get a lot of calls from people that are looking to purchase an Obamacare plan and kind of pitch their group insurance. The fly in the ointment in all of that is that if you are offered comprehensive health insurance means those 10 essential benefits that I talked about in the first segment, then you are not eligible to apply for a premium tax credit, which means you would end up paying full price. Obamacare can be, and of course it is referred to the Affordable Care Act, but most people know it as Obamacare, which is why I refer to it as that. Most people don't realize that Obamacare probably is the most expensive, given that they do have to contain the 10 essential benefits, the biggie being the pre-existing health conditions. So you are in a risk pool with people. So if you're 27 years old and you're off your parents' plan and you're very healthy, it can be a very expensive plan for you because you are in the same risk pool with people who could possibly be 64 years old with stage 5 pancreatic cancer, lung cancer, a family of 5 who's utilizing the maternity and newborn care. So a lot goes into the formulations for Obamacare, for the Affordable Care Act. And that's why while it does cover pre-existing health conditions, it does come with a premium. The other issue that a lot of people are a little bit sideways with, if you will, about Obamacare is they tend to be, not always, there's a couple of states that have the PPO plans, which are the Cadillac of health insurance plans. That stands for the Preferred Provider Organization. But most of them on the Obamacare plans are HMOs, which are very restrictive, which means you have to stay in your network. A lot of times there's only a handful of doctors that take your plan. Some of the hospitals don't even take it. I've had panic calls from customers who have gone to one hospital only to find out that they don't take it and they have to be transported over to another one. So it can be, I don't want to use the word nightmarish, but it can be. HMOs are very, very restrictive. And in some cases, I know there's a couple of states that I'm licensed in that very few doctors even take the plan. So it can be a little bit difficult, but I would say this. If you're offered an HMO and you've got a premium tax credit, and it's your only option for health insurance, especially if you have pre-existing conditions, you'd be an absolute fool not to take it. So in some cases, the provider can help you find doctors. There's usually a provider lookup on their website, so you would be able to find somebody. The issue for most people is it's not the provider that they've been going to. Remember, you can keep your doctor. That didn't happen. But given what we're going through with the pandemic, I would beg to ask anybody whether or not they would want to be uninsured, given what could go wrong with COVID and anything in general. I mean, your appendix could rupture, for crying out loud. So it's definitely, I would say, not the most ideal in some states. Some states have absolutely nailed the Affordable Care Act. Oklahoma being one of them. I absolutely love writing in Oklahoma. Missouri's another one. They really have their stuff together when it comes to the plans. And the big news is some of the carriers they have. Those are the ones that those plans are just the Cadillacs and of the providers. So those are just two of the states that jump out at me. Nebraska is another one I like. But some of the states are very, very restrictive. One of them being the state I'm in, Massachusetts, California, Colorado, Washington, New Jersey, Washington, D.C. Pennsylvania last year went to their exchange called Penny. And Las Vegas, didn't mean Las Vegas, Nevada is the other state that also offers their own exchange. Once you get onto once the state goes onto their own exchange, most of the private care providers end up pulling out of those states because it just, quite frankly, isn't worth it for them to continue offering it. So that can be a little tricky as well. So if you have lost your coverage through your job, or you've retired. I get a lot of calls from people getting ready to retire. They're going to have a little bit of a gap. And a lot of them want to compare what they're being offered through their COBRA. COBRA was a law that was passed under President Bill Clinton, which gives you an 18th month window to which to bridge your health insurance coverage until you either, in some cases, get another job and new coverage, or you retire and you go on to Medicare, which I'm going to do a whole show on Medicare at some point as well. Yeah, I mean, a lot of people have to go on Obamacare, especially if they have pre-existing health conditions, because you simply would not qualify for private insurance, which I'm going to get into in the next segment. So it's a great way to bridge that. In most cases, they'll offer you the first 6 months of a COBRA. I would tell anybody who is being offered a COBRA to make sure you read the fine print, because sometimes it's a little bit less than going the Obamacare route. The issue is usually after 6 months, they have the ability to raise your rates. And in some cases, I've had people call me and the premiums have actually doubled. So you got to be careful about that. You've got to make sure that whatever plan, whether you go COBRA, the good news with the Affordable Care Act is it's income based. So, unless your income changes substantially, and I highly doubt that if you're retiring, it will, you could have an issue with that and have to, if you end up going on the COBRA. Once you go on the COBRA, the Affordable Care Act, if we're not in open enrollment, would be taken off the table for you. So something to think about. All right, we do need to take a quick break. This is Elevating with Marcia on XM 203, Sirius 217, and on the Sirius XM app at 967 Sports, Byline USA Radio Network. You can also find me on iHeartRadio, Amazon Audible, Stitcher, iTunes, TuneIn, and the American Forces Radio Network. We're going to take a quick break. When we come back, we're going to close out this segment with health insurance and everything you need to know, and we're afraid to ask. Take a break. We'll be right back. If you're not using podcasting for your business, you will. Not having a podcast is like not having a website. Hi, this is Marcia Hawkins of Elevating with Marcia on Sirius XM Channel 211, the Dan Patrick Channel. You can get your business on my podcast. It's a great way to create superfans for your business with a controlled message in a news format. What better way to get in front of your intended audience, your clients, your customers, or patients? Please contact me at hello@elevatedmediaesq.com about getting your business on my show, Elevating with Marcia. We also can create a personalized podcast that you can use on your website or social media channels. Contact me at hello@elevatedmediaesq.com and join me on Elevating with Marcia on Sirius XM Channel 211, the Dan Patrick Channel.
My doctor prescribed me Viagra. It wasn't covered by my insurance, so it was costing me like $65 a pill. That's expensive.
Over 20 million guys like us use Viagra. Over a certain age, we just need it. I found a way to pay less than $3 a pill and get virtually the same effect of the $65 pill. I heard an ad just like this on the radio, called, and for $99, I got 40 generic versions of the $65 pill. Save yourself money and call right now and get over 40 pills for $99. There's no embarrassment here to use Viagra. If we're over 50, we need it, but not at high prices. Call now with your credit card and get the 40 pill special for just $99.
800-399-3691. 800-399-3691. That's 800-399-3691.
The double play!
It's baseball season, and you're ready to go all out. So you ordered the essentials to make game day a success, like a jersey, a power recliner, and a bigger screen. And you used your Bank of America customized cash rewards credit card, choosing to earn 3% cash back on online shopping. Rewards that you put toward an essential piece of the celebration, an air horn. Apply for yours at bankofamerica.com/more rewarding. Copyright 2021, Bank of America Corporation.
Between jobs, retiring, or just need health or life insurance, please visit myhealth-quotes.com or call 833-687-5261. Before you try to get a quote online, call us. We will provide you with the information most sites will not. We teach you exactly what life or health insurance plan you qualify for, how to use your plan, and maximize your benefits. We provide you with the information to make a knowledge-based decision to ensure selecting the right plan. myhealth-quotes.com to schedule an appointment.
All right, welcome back. This is Marcia Hawkins on Elevating with Marcia. Today we are talking in the final segment about health insurance. I'm bringing it up today because we are rounding the corner on the final week of the open enrollment period that they brought you from the federal government because of COVID. So it's going to be ending in most states on August 15th, which would allow you for coverage to begin on September 1st. If you miss that window, then unfortunately you are going to have to wait until open enrollment. Colorado and California start in October. I believe it's October 15th this year for both those states. And then, of course, open enrollment starts for the rest of the states on November 1st. Most states end December 31st. However, a handful of the states, such as Massachusetts, Colorado, Nevada, California, and I believe Pennsylvania is also going to extend theirs next year into January and in some cases February for your coverage for 2022. However, it is important that if you have lost your insurance, the window is definitely closing, and I highly recommend you either call me or call a qualified agent to find out. You can visit myhealth-quotes.com, and all of my contact information is there as it pertains to insurance. I'd be happy to help you. You can also get on my mailing list. I'd be happy to add you to it, where I send out newsletters about every 2 weeks with usually about 4 or 5 articles about everything that pertains not only to health insurance, but about preventative care and just some neat topics, exercise, diet, fitness, all of that. So if you want to sign up for my newsletter, stop by myhealth-quotes.com. You can also find me on Facebook, and you can leave me a message there as well. All right, so we're talking about health insurance. I want to just recap a couple of things about the Obamacare plans. They contain the 10 essential benefits. They do contain pre-existing conditions. In fact, there's not even any health questions. So if you have COPD, or you're pregnant, or you have any type of pre-existing health condition, it is a non-issue. It is probably the best insurance money can buy with what's out there. However, there are some qualifying factors. So a couple of the questions that I get all the time is people get frustrated. A couple things. You do have to file a tax return. If you're married, you have to file a joint tax return. Very, very important. There are some income thresholds. For example, in some states this year, you had to make at least $16,500 in order to qualify. You'd be shocked at how many people fall on that fine line where they're a couple of $100s short. Or in some cases, they were able to collect unemployment last year, and that kind of put them into another whole realm, and they actually saw an increase in their premiums. So it's really important that you establish a relationship with an agent that does the Affordable Care Act and understands how it works, because there are a lot of tax implications if you don't understand the plan. If you don't understand the income guidelines, there's also quite a bit of things that could kind of go wrong when you go to file your taxes. So it's always good to get that information. Now, I am not a tax professional, but I do understand the guidelines. And if there's ever a gray area, I would definitely, shoot you over to your CPA or whoever does your taxes, or even the marketplace would be able to walk you through what some of the tax implications would be. Unfortunately, when I'm processing an application, it would be really hard for me to be able to know how that's going to unfold when you go to file your taxes. There's so many things between your deductions. If you file, long form, it doesn't afford me the view to find out specifically what your deductions are. If you own a home, obviously you can write off your mortgage interest. So there's a lot of factors that go into that, and I simply would not have that information. So I take simple information. Like, for example, if you're self-employed, we use the income after taxes. So you had a lot of leadway there, but for people that have a lot of deductions and their income goes way, way down, in some cases that can be a negative, because then you're not going to hit that income threshold to qualify. Like I said, in some states it's $16,500. If you have a lot of deductions and you're a lot of dependents and you're able to get your adjusted gross income way, way down, you want to make sure that you're at least at that threshold to be able to qualify for the Obamacare plan, because a lot of self-employed people are on the Affordable Care Act. So it's very, very important. So again, not to be redundant, it's always advised that you align yourself with a very knowledgeable agent that understands all this. The last thing you want to do is go file your taxes and find out that you owe $6,000 in health insurance premiums back due to that premium tax credit. So very, very important. Also, if you are employed and your employer does not offer health insurance, if you happen to work for an employer that has under the threshold of requirements where they don't have to offer health insurance, or they offer a non-qualified health care plan, meaning it doesn't contain the 10 essential benefits like maternity and pre-existing conditions and all of that. And some employers do offer that, which I'm going to talk a little bit about in a moment. They offer basically what we offer outside of the exchange, which would be a short-term plan for a year. And it's a little bit different, and I'm going to delve into that in a few minutes. That said, if you are employed, it actually goes before your taxes. So if you make, let's say you make $20 an hour, how we formulate what you make gross per year, we actually double the hourly rate. So we would calculate that at $40,000. I always confirm if that's about what the customer, the client feels that their income is, and then I kind of take it from there. We need to factor in the zip code that you live in, the county that you live in, because some carriers don't offer their plans in all the counties in each state. So it's very, very myopic, very individualized, and there's a lot that goes into that. And then from there, I do ask about your health only because I want to make sure that I get you on the right ACA plan. I want to make sure any expensive medications or any medications that you're on, for that matter, are covered. And I want to make sure that that plan will actually pay for them. Again, that's another myth. People think if they have health insurance that any medicine that they're on, any prescription that's written, that will be covered. And that simply is not true. So I have a little tool in my arsenal that allows me to dissect down each plan, and I'm able to formulate whether or not your doctor is in network and whether or not the drugs that you're currently on are actually going to be covered. Another neat thing that the Affordable Care Act offers is all your preventative is covered prior. So if you want to go for your wellness exam, all of that, and some diagnostic imaging and all of that stuff. A lot of that stuff is covered prior to hitting your deductible, which is wonderful. So obviously, preventative care is the best form of health insurance out there. So I highly recommend that if you do have an Affordable Care Act plan or group insurance, that you make sure that you get your wellness visit in and any type of blood work that you need to have done. Obviously, preventative is the best medicine, and you're able to tackle things before they get out of control. All right, so I do want to talk a little bit about private insurance, because that's where the big myth comes in. A lot of people feel if they buy, say, a United Healthcare plan or a Aspen or a Premier Choice plan, that they are actually, it's not going to matter that they're a type 2 diabetic or they've had cancer in the past 5 years. No, it is a big deal. If you are entertaining for whatever reason, and I get a lot of calls, and I think I know why a lot of people shy away from the Obamacare plans. Again, there's people that don't file their income taxes, so that's an issue. There's people that it's too expensive. They might make too much money, and the plans are, I mean, I had a couple the other day. It was going to be $4,400 for just a couple in California, $4,400 a month for their health insurance plan. They made too much money, did not qualify for the premium tax credit to help them pay for their premiums, so they're opting to go to the private insurance route. Luckily, I offer a plan in California. Very few people offer it. California has very limited coverage outside of their exchange, but this particular plan is offered in that state, and we've decided that that's the route we're going to go. They're not interested, and that brought their premium down to about $900 a month. So yeah, that's quite a bit of change in between what they would pay on the exchange and what they would pay privately. But pre-existing conditions are not covered. And when you're going with a private plan, I have really gotten away from plans that are not medically underwritten. And the reason for that is there's a lot of plans out there short term, whether it's 3 months, 6 months, a year. Most of them cap out at a year. They do absolutely no medical underwriting. So typically when you apply, you'd be approved, and then, God forbid, you have to go access that health insurance, and they then will do medical underwriting. They're going to rip through your MIB report, which is kind of like your credit report for your finances. If you were prescribed a medication for one thing, and you're being treated for something else, or were treated for something else, in the insurance company's eyes, you may be taking it for one thing, but they would disqualify you for the reason that drug is usually prescribed for, like bipolar disorder. Some people take bipolar medication. That would be a knockout question. And some people take some of those drugs for various reasons, and they're not clinically diagnosed with bipolar disorder. So in that case, if something were to happen and you were to be hospitalized and they pull the MIB report, they actually could deny the claim and cancel the policy. So I've kind of gotten away from that. The only time I recommend those is if you're in between jobs and you only need 2 or 3 months worth of coverage. They're great plans as opposed to going the Obamacare route. But a lot of it's just a paperwork issue. But if you're really healthy and you're young and you don't anticipate any issues, it would be great for something like a ruptured appendix, or, you fell down and broke your leg. But it's not for people. Short-term insurance is not for people who are older, maybe have not taken the best care of themselves through their life. They smoke cigarettes, they drink alcohol, those types of plans. If you're not the healthiest, I would not recommend you go that route. Medical underwriting, once you're approved, you don't have to worry about whether or not they are going to pay their claims, because they have already done the heavy lifting. They have pulled your MIB report and they agree with what's in there, and subsequently they are allowed and they approve you. So it's very, very important. Again, private insurance does not cover pre-existing health conditions. Very, very important to understand. And the ACA plans are the most comprehensive, most expensive, but they are the plans to go with if you have a pre-existing health conditions. Can't believe we're almost out of time. But we do need to take a quick break. This is Elevating with Marcia on XM 203, Sirius 217, and on the Sirius XM app at 967 Sports Byline USA Radio Network. You can find me on iHeartRadio, Amazon Audible, Stitcher, iTunes, TuneIn, and the American Forces Radio Network. We're going to take a quick break and close out the show when we come back. Again, Elevating with Marcia on Sirius XM Sports Byline USA Radio Network.
Matthew.
Huh? Oh, sorry.
It's okay. I just need you to listen to me.
I know that a lot of times, Mom, it might not seem like I'm listening to you, but I am. I hear you. And what you say really does matter to me.
I mean, let's be honest. No kid likes rules, but I get why we have them. I hear you, and I know it's because you care.
All the talks we've had over the years, including what you've told me about not using alcohol and other drugs, they stick with me. And believe it or not, they really do make a difference, especially at times that matter most.
Hey, want a drink?
No thanks, I'm good. So thank you, Dad, for talking and preparing me for what's ahead.
Thanks, Mom, for never giving up and always being my biggest fan.
Thank you for letting me know what you expect, so I can try to meet your expectations.
Thank you for talking.
For more information about talking with your kids about underage use of alcohol and other drugs, visit underagedrinking.samhsa.gov.
At 28, I had struggled with opiate and meth addiction for 12 years. I did and said things that the sober me never would have done. One day I realized I was not invincible. I was not exempt. And that's when a friend told me about elite rehab placement. They gave me the tools I needed to get sober, and all it took was the one phone call.
Elite Rehab can help you start to break your addiction problem and get sober in as little as 7 days. And we'll work with your insurance provider to help cover the costs. Plus, we have travel assistance programs to get you here by plane or train. Make this free call right now to learn more. 800-403-5912. 800-403-5912. 800-403-5912. That's 800-403-5912.
Hello and welcome back to the Ronnie Deutsch Tax Program. On the line is Paul from California. Hi, Paul. What's your tax problem today?
Hi, Ronnie. Love your show. Listen, I've got a big problem. You see, my paycheck was garnished last week, and I'm only getting half the normal amount. To make matters worse, the IRS froze my bank account. Listen, I'm embarrassed and scared. I need some help.
Listen, Paul, you don't need to feel embarrassed. You just need some tax help. And the great news is the IRS has some unbelievable programs that can eliminate your tax debt so you don't have to worry about having your paycheck garnished or your bank levied. Doesn't that sound great?
It sure does, Ronnie.
Then do yourself a huge favor and get a free consultation right now and tell them the tax lady sent you.
855-715-5721. 855-715-5721. 855-715-5721. That's 855-715-5721.
All right, everybody, we're out of here in 2, and I want to thank you for tuning in and joining me today to talk about what I love to talk about best, health insurance. Another podcast of Elevating with Marcia is in the books on XM 203, Sirius 217, and on the Sirius XM app at 967 Sports Byline, USA Radio Network. You can find me on iHeartRadio, Amazon Audible, Stitcher, Tuned In, iTunes, and the American Forces Radio Network, my favorite. Today's show is brought to you by myhealth-quotes.com and elevatedmediaesq.com. Stop by our Facebook or Instagram page or visit me at marciahawkins.com. I would love to connect with you. If you're interested in learning more about a podcast for your business on Elevating with Marcia, I invite you to direct message me on Facebook or Instagram at Elevating with Marcia. We can take the hour and talk about your business, your products, your service, or if you have a cause that's near and dear to you or you wish to promote your cause. Podcasting really is red hot right now, and it's a great vehicle to drive sales and awareness. The 1 hour podcast is going to allow you to connect directly to your intended audience with your direct message. In addition, your podcast helps with providing content you can utilize on all your social media channels. It is a powerful marketing investment and a strategic means to link your business with customers, clients, and patients. If you're a business owner looking to market your business with a podcast, direct message me for details via Instagram or Facebook. All right, everybody, that's it for today on Elevating with Marcia on Sports Byline, USA Radio Network. Remember, always remember, be in the minute to win it. I hope you make it a great week. Adios.